I've been performing rhinoplasties for about 35 years. Well, most aesthetic concerns can be well addressed with rhinoplasty. It is incredibly individual as to exactly what is happening aesthetically. The whole goal of rhinoplasty is not to look like there's been a rhinoplasty. Trying to make a nose look like it's normal, fitting one's face, and addressing the various factors that play a role in that. Well, the ideal candidate is certainly someone who has realistic expectations, number one. Someone coming in with extremely minor changes that in an otherwise very good-looking nose may never be the happiest individuals with an outcome. However, most people we see really do have very realistic expectations, and we're able to assess and address their concerns. There are some factors that really do play a role in who's the very best candidate. Skin quality does play a role. Someone with very, very thick, sebaceous skin, we can get good results, however, is not the greatest candidate. The analogy being that if I were to take a shape or say a chair and drape a piece of heavy burlap over it, you can only do so much. Put a piece of silk over it, you see all of the fine details. Someone with thinner skin, where we can really achieve nice definition, nice tip definition, truly will have the best outcome. Rhinoplasty is very quick and easy to recover from. There is, in fact, often very little bruising and very little swelling. There is no packing used in the nose, and so someone is breathing instantly. There is remarkably almost no discomfort. I've never actually even understood why, but it's one of those procedures that no one ever seems to have any discomfort, be that as it may. It is obvious that something's been done because almost always there's a little doohickey over the nose, and so that's on for 5 days, so pretty hard to hide. But once that comes off 5 days later, it looks instantly better than at the get-go. Tiny little bruising, if it's there, can easily be covered up. So generally by 5 days, a little cover-up can look very, very good. The style of rhinoplasty we will almost always performed is called an external approach rhinoplasty, where I do make a very small incision that is right in the so-called columella of the nose. This allows for tremendous precision in rhinoplasty by being able to raise a little bit of tissue, see everything in its natural status. Then I'm able to truly work in almost sub-millimeter accuracy to get as close to perfection as I can get, and then allow the very best outcome. The incision is great. I've never seen a bad incision. It is you can know someone forever and never notice the slightest incision. Rhinoplasty will range from generally $6,000 to $8,000. It will be related to some extent to the degree of change that's taking place. Someone with a perfectly normal tip and just say a little hump may be on the lower side of that spectrum. Someone with more changes would be on the higher side of that spectrum. Well, not a bad idea to perhaps look at some images and see whose nose do you think looks good. We're always happy to look at the images, and most individuals do seem to bring in realistic images, but I can look at that, get a sense of what is happening, actually analyze the images they bring in as to what is it that they're seeing, and then apply it to our consultation and discussion of the outcome they'd like to achieve. When it comes to rhinoplasty, what I think we achieve is really great results across the board. Rhinoplasty is a very difficult operation. It's one that is very hard to teach surgeons. There are individuals who perform rhinoplasties badly for a lot of years, and I've corrected a lot of those cases. The real important factors, again, is that it doesn't look like a rhinoplasty. It's natural. It fits the face. It flows well. Rhinoplasty it's not a more is better procedure. The nose has to simply fit. You have to be very careful not to remove too much tissue, and yet address all of the factors that result in great balance, great aesthetics, curvilinear lines that flow and fit well with the face. That I feel is what we achieve all the time.